everybody who's taken the time to join us today. It's a privilege for Direct Relief to be part of this collaboration and this global coordinated effort. You know, the old joke is everyone is for coordination as long as they are the coordinator. And that is not the case here. I think it's a rare privilege for us to be part of this. So I think the slide that's up right now, you can see what the progress has been. I think it's 42 million units of PPE, 12 countries so far. I think we're breaking it down by the type of product. And just as kind of a couple of contextual points I think are important, at least from my perspective. Direct Relief, this was the largest purchase that our organization has made in 72 years, other than the building that we built so that we could be an accredited drug distributor. As a signal of the seriousness with which our organization takes this. I think, as Madeline and others have said, the role and importance of community health workers is unquestioned. We saw it in Ebola. We see, you know, in the United States, Direct Relief is supporting community health workers here for the exact same reason. They prevent hospitalizations, they detect disease early, they keep people healthy and out of the hospital. It's a low cost, high value, high impact investment. And it's unfathomable that they're last in line for support, but they are. So I think the effort is to really mobilize the private philanthropic resources as the public institutions are clearly overwhelmed. By way of contrast, you know, the WHO reported recently what their provision has been for this effort. And I think you can see, they reported that they've been able to provide 3 million surgical masks, and the consortium has delivered 22 million so far, plus 500,000 KN95 masks. WHO reported that they were able to provide 2 million gloves. The consortium has provided 35 million. WHO reported they could provide 200,000 surgical gowns. The consortium has provided 975,000 so far. WHO reported they could have provided 100,000 face shields, and the consortium has provided 850,000 so far, and we're still far short. So I think that, you know, as an example, that's a pretty sobering reality, and it's not a criticism of WHO. It's an observation of what's needed to complement their efforts, and those are the ministries. It's unreasonable to expect that here in the United States, where we're struggling to just do PPE, that we can expect countries with far fewer resources to mobilize and connect them on their own without some help. So I think the idea and the urgency of it has been clear. The value of community health workers is proven. And so it's been a real privilege for Direct Relief to join with the 29 other groups and put forward both what we do, and work with all of those. For everyone listening, I think it's, you know, it's a rare occasion where, you know, everyone's expertise and what they bring is leveraged by everyone else's, including anyone who contributes funds. The groups are using what they've got. They're not charging this fund to do it. This is what they do, and this is what Direct Relief does. So I think it's the photos you saw if you tuned in early of the flights leaving from Shenzhen. That was the World Food Program. That's the backbone kind of operational arm of the United Nations. They agreed to haul this for free. So it's been 240 tons on 11 cargo flights that, had we done it even at low cost, it would have been $4 to $5 million in costs that have been averted. So really the funding pool is to just obtain the items at the lowest cost possible. And we've been very fortunate to be able to do that. Direct Relief's cost of goods obtained is usually zero because companies like 3M and BD are so generous with their product contributions. That's not possible in this case, as the world market has been so upset, prices remain high. And I think when we have been able to go out and purchase with the $10 million that Direct Relief put forward, followed by the $2.5 million that the Crown Family Philanthropies put in, which was astounding, the pricing that we've been able to get, it's not it's discounted because it's not a commercial arm's length transaction. People understand the groups involved. We have no agenda. We're just trying to get help with really right now a relatively small pot of money to people who don't have it, won't get it otherwise, and need it now. I will add that direct relief works in emergencies, and one of the things you learn is that an emergency means you've got to move. You cannot analyze global warming in all of its context when there's a fire burning outside town. So I think you have to do it thoughtfully, but it has to be done fast. So I think it's a privilege for us to be part of it. We're committed, obviously, deeply to seeing it through. And for anyone who's in a position to participate in any way, please know that you will get the best efforts of all 30 of us collaborating partners.